Next, we're going to talk about bulb suctioning, and this is a resuscitation device. And you can see it's just a little blue bulb, and this is very useful to the parents and to the nurse, especially the first few days after delivery. Most babies are born vaginally, and they get a big squeeze, the big physiologic squeeze, that when it compresses the lungs, it pushes the lung fluid. Remember, they were breathing amniotic fluid in utero, so there's amniotic fluid in their lungs. They only did that to strengthen their lungs. Of course, they did not get oxygen from breathing the amniotic fluid. They just gained muscular development of their chest wall. So when they get the big physiologic squeeze, most of the time they push the lung fluid out, and most of the time they don't have a lot of mucus. Now, some babies have more amniotic fluid and mucus that's coming out of the airway, and so what you want to do, sometimes they can gag and spit, and a lot of the C-section babies have more, of course, because they did not get that big physiologic squeeze. So a lot of times they will have a lot of excessive mucus and fluid coming out of the airway. So Jenny's going to demonstrate how we would suction the baby with this bulb suction or resuscitation device. First, you just pick it up. You're going to depress it with your thumb and gently put it in the side of the baby's mouth. You're not going to go down deep into the throat, as that can cause trauma. Then Jenny's going to take her thumb and release, and that will aspirate the mucus or the fluid out. And then you can see how Jenny discharged it to the side to get rid of it. Now she's going to go in on the other side and go in lightly, and then let her thumb release, which will aspirate or pull it out as well, and then she discharges it. And we're hoping that that's all we need to do for our baby.